Hi, my name is Dr. Angela Sanchez. I am the Medical Director for Primary Care at Loveless Medical Group in Albuquerque. When I first learned that we were going to transition our electronic medical record system to Epic, it was quite daunting. It is a big change, but I know now 60 days in that we're only growing stronger as an organization and that we're going to continue to improve. So it's a good thing. So Epic has really improved the quality of my workflow, even just in the first 60 days. The thing that I think has impacted me the most is its flexibility. I can create templates for just about anything. Patient notes, patient letters, tasks, and even the actual workflow itself. So because I was able to coax Epic to mirror my previous workflows, I think that's really helped me. And the more we learn about personalization, I really feel like everybody's going to become more efficient in the system and also become more efficient in their daily work. I feel that the change to Epic has really impacted Loveless Health System as a whole. Epic's quality reporting and quality capabilities are really unparalleled amongst other electronic medical records. Not only is that going to help us with quality reporting for government agencies and things like MACRA on a global sense, but on a more local front, I'm able to pull up day-to-day work and things like what's my average A1C for a diabetic patient. That's going to help me to do better in my job. And each of the providers actually learns how to create those own reports for themselves so they can use it to monitor their quality on a monthly basis. I can ask questions like, for my hypertensive patients, what do their blood pressures look like? And so I think it's going to encourage us to use this tool in a whole new way and improve the quality of healthcare throughout the whole system. Thinking about my patients and continuity of care, of course, nationwide medical practices are required to have an electronic medical record. That was done in part to help with continuity of care. The problem is that the mandate never said how these records should talk to one another. This has been a major problem. We know that it's led to duplications and errors. You'll hear about it on the evening news frequently. This system has its own platform called Care Everywhere. And so Epic patients in our practice have medical records that are shared with Epic practices across the country. And current estimates say that about 50% of all big healthcare systems and hospitals use Epic. So not only are our patients able to, or are the records able to be transferred from all Epic practices nationwide, but also other systems that don't even use our electronic medical record. This is really exciting. So in my own practice, I've seen, I had a patient who was involved in a motor vehicle accident out of state, and the records were transferred to me. I didn't know, of course, that she'd been in an accident, but I could see what was happening to her. In addition, I have a patient who has a rare cancer who's being treated at MD Anderson in Houston. And every time she checks into that front desk, it populates in my in-basket. I think that's really exciting. And again, it's going to transform the way we do medicine. I've already seen efficiencies in my practice. And we've only been in this system for about 60 days. So I feel like every time I turn it on, I learn something new. I've seen efficiencies in workflow. I've seen efficiencies in messaging. And lots of just daily things that happen. I'm hoping that as we continue our exposure to Epic, that this is only going to get better. If I could say one more thing, one piece of advice, anytime you change your workflow, going from a paper chart to an electronic medical record or from EMR to EMR, it's hard, it's difficult. And I know that when we started thinking about transitioning into Epic, it, like I said, was pretty daunting. The people who did best, the providers, staff, and really anyone who has exposure to this system, did better when they practiced. So thinking back really 3 or 4 months before we started in this process, especially the providers who created templates so that they could mimic their own natural workflow, personalization as much as they could long before the go-live date. Those providers really came back up to speed much faster, and in the long run are much happier. So, we really strive for that work-life balance so that we can, everybody wants to deliver good quality care, and we've gotten much better at that faster and seen that the providers who really spent time learning the system are happier today.
Good morning. I'm Dr. Susan Lewis, the Systems Medical Director for the Hospitalist Program for the Loveless Medical Group here in Albuquerque, New Mexico. And I'm here today to talk about Epic. When I first heard that Epic was going to be rolled out here in the Albuquerque market, I was very excited. And I know today they said you can say whatever you want, but I really want to let you know I was very excited. This is my third experience with Epic in my career. And my experience with Epic has been very positive, very patient-centered, and the incredible opportunity for us to offer this to our patients in Albuquerque, to me, is very exciting. Our workflow here in Albuquerque, I think already is reflecting some improvement since we've rolled out Epic just in the last 30 days. We met last week with the Epic team. We reviewed our processes to date. And I'm very excited to say that we're beginning to see improvement. Part of what we see with Epic, I think, in my experience, has been that there may be some workflow issues, things that we've adapted to over time. We behind the scenes begin to fix it. And Epic gives us an opportunity to bring it to the forefront in a way where we really see that if we outline some clear-cut processes, that we really help our patients better. It's really patient-centered and patient-focused. When I talk about patient-focused efforts for Epic, it's reflected in how we approach the patient from the time they enter our doors. We really collect data on every patient in a way across the system that really reduces patient errors, it increases patient safety, and it collects data in a way that we as physicians can make better informed clinical decisions, and that's really been proven with Epic over the last 20 years. When you ask about how our staff has responded to Epic over the last 60 days, it's been a mixed bag. I'll tell you, it's been challenging some days. It's been exciting when providers discover, oh, I have access to this kind of data and it's summarized for me in this way. You can see the excitement reflected on their face. It's a level of sophistication in presenting data that I think many of them haven't experienced here in the Albuquerque market. And yet, we also know that change can be challenging. There are some people who automatically see that as an opportunity for creativity, problem-solving processes, and then there are other people who may not be as resilient and focus on how challenging it is. And I feel very positive that we have excellent leaders and leaders within our group who are really bringing people forward. We're also lucky enough to have other people like me who've experienced the system in a very positive way and are really stepping up. I'm excited to see my colleagues really offer to come in and help their peers. So I think that's positive overall. I think that rolling out Epic is a great opportunity to role model that collegiality and teamwork that the current environment of healthcare is really challenging us to do for better patient care. I really believe that celebrating the wins, celebrating things that people are excited about. For a good example is we have a provider who's very good at working with his tablet, and he's offered to go around and help his other peers get faster. And I think really what we call here cross-pollinating, that kind of leadership and that kind of success has really helped our team as a whole. I think in terms of thinking about what we missed and what I might recommend to the other markets rolling this out would be make sure that you identify before you roll out people who've used Epic before so that you can make those people readily available, and also make sure you're very clear about rolling out lines of communication so that the people who do need help really know how to access that help and where to find it.